Ladies and gentlemen, believe it or not, the worst measles outbreak in decades, and probably the biggest outbreak in America right now, is in New York. Now, if you've been following me for some time, a lot of the measles came from people traveling to Israel where they have a bad outbreak, and they brought the disease back to the US. And that's usually how many, not just measles, but many diseases spread on a global or pandemic level is because of travel. People picking up the disease, not showing signs right away, and then all of a sudden they have an outbreak, and by then it's spread to many people, and you don't have to have the actual outbreak to spread measles, is what I'm learning. You can have the virus, be carrying the virus and in contact with many people, and you're spreading it without it even being visible on the surface of the skin. So it's pretty, it's a very contagious virus too. Measles, very contagious. It really doesn't take much to spread it to others. And I remember when I was growing up, I actually had measles as a child. And some people had it so bad, y'all. It was on their tongue and on the inside of their inner cheeks. And some people even had it in their eyes. It really, this thing really shows up everywhere on your body, on your palms, on the bottom of your feet. It shows up everywhere. So, New York is fighting its worst outbreak of measles in decades. But I want you to look beyond this, ladies and gentlemen. This is happening because they have been pushing vaccines forever now. We all know this. But what this is actually revealing is there's a lot of people walking around that never had vaccines done. That's what this is revealing. They're pushing vaccines on people, and at the same time, they're not even getting their own families vaccines. Just thought I'd put that out there because that's exactly what it's revealing. So when they try to push vaccines on Americans, it just go to show you there is a huge amount of Americans that will not and never have been vaccinated, and they will not get their kids any vaccines either. At Clarkstown Pediatric, so they're saying the New York babies, measles, are now accelerated. And they're trying their best to get as many people vaccinated as possible. But there have been several outbreaks within New York, and they've been pretty big. Now, the state has had 167 cases of highly contagious measles since September, making it the worst year for measles since the 1990s. That was the last time they had a major outbreak. So pockets of unvaccinated children have provided fertile ground for the measles virus to take hold, although measles was eliminated in the United States. No, it wasn't. No, it wasn't. So it's saying that it was eliminated. The virus has been brought back by travelers to Israel, as I had told you previously, which has been battling an epidemic of measles in Israel for months now. So they got the same thing going on there. So the victims, mostly members of a close-knit Orthodox Jewish community across the state. So it's wherever these Orthodox Jews are living, that's where the biggest outbreaks are occurring. And remember, New York has the biggest Jewish population in the country. That's where a lot of them are. And there are measles outbreaks here in New Jersey in those same areas. In mainly those areas where you have a big Orthodox Jewish population. And many of them that live in New Jersey live very close to New York. They live very close in those areas. It's a clear and present danger right here in our community, said Douglas Puter, a pediatrician at Clarktown Pediatrics. His practice is right in the middle of the biggest outbreak in New York's Rockland County. Last week, the county reported 105 cases of measles since the fall. More than 80% on average had not been vaccinated. See, 80% of them never got a vaccine. But I want you to always remember, these are the same people pushing vaccines on others. Never forget that. And just had 3 cases, had both received doses of measles vaccine. So, and Europe also had a bad year for vaccines. Now, when I did a report on Europe, I think it was like 41,000, over 41,000 cases of measles have broke out in Europe. And I did that story, it was probably back in September. So it's going on strong, not just here, but in other parts of the world as well. Local, state, and federal health officials are battling to fight the outbreaks, which they believe have been fueled by a combination of anti-vaccine propaganda, lax enforcement of school requirements to vaccinate. And that's what I want to know. How are these kids going to school? They must be going to private schools where they relax those rules, because I know in public school, they pretty much will put your child out if they don't have all their shots. So these schools, well, not unless they're secretly relaxing the rules on certain students and then making other students get the vaccine, which could be the case, y'all. I mean, it wouldn't be the first time double standards were practiced. We all know this. And a growing trend among some families to turn away from standard medical care. As a result, some private schools in the county reported vaccination rates had fallen to as low as 50%. Yes, so these people aren't getting their kids vaccinated, ladies and gentlemen. Let that be an eye opener for your kids as well. It takes a vaccination rate of 95% or higher to prevent outbreaks of disease. Well, apparently they don't care. So here is a map. Measles vaccination rates for 2017. And this is a map that's showing measles, mumps, and rubella vaccination coverage among children 19 to 35 months. The government's target is 95%. So you can see in the dark, Virginia has a very high rate of people that receive vaccines, 97.6%. And this is North Dakota. North Dakota have 95.7%. And so you can go to your state. Texas, 90.3% of the people that have children have been vaccinated, and that's between 19 months and 35 months old. New Mexico, California, 92.9%, Florida, 91.9%. So, wow, North Carolina, 88.0%. 87.2% Colorado, Utah 88.7%, West Virginia 89.9%. So, I'll leave the link to this article and you can come out and point it on your state. Washington State 88.5%. Okay, Oregon 90.3%. Okay. So I'll leave the link to this article in the description box, ladies and gentlemen. Just be careful with your children out here and try to do everything you can to keep their immune system up. I know it's not always possible to prevent these things because my son actually caught chicken pox from a cousin in the family. And she had just got over the chicken pox, but nobody said anything in the family because she was still contagious. They thought she was over because didn't have the outbreak on her skin. So I guess they thought she was fine. So after the family reunion happened, it must have been like a week later, my son had an outbreak and he played a lot with her. So it's easy to spread this stuff. It is very easy. But please tell me what you think, ladies and gentlemen. Please leave your comment and subscribe. Don't forget to hit on the notification bell, and I will see you on the next video. Peace, family.